you very much. This morning, the subcommittee released reports exposing the truly horrifying conditions in nursing homes across the country in the early months of the pandemic. And I can remember like it was yesterday how the Trump administration abandoned nursing home workers and other essential workers as they pleaded for the federal government to help them get critical supplies necessary to protect themselves on the job and curb the spread of the virus. But instead of mobilizing a serious federal response, President Trump contemptuously stated that his administration was, quote, not a shipping clerk. And he told the states to go and find their own supplies. Today, I'm actually reading about a new book that's been published quoting Melania Trump in a phone call with former New Jersey Governor Christie, and in which she discussed seeking help convincing her husband to take the pandemic more seriously. You're blowing this, she recalled telling her husband. The authors, right? This is serious. It's going to be really bad, and you need to take it more seriously than you're taking it. He just dismissed her. You worry too much, she remembered him saying, forget it. The new documents demonstrate just how severely nursing home facilities were affected by PPE shortages under the dereliction of duty of the administration. So long before Donald Trump did nothing to rescue his own vice president, Mike Pence, as he was being hounded and chased out of the Capitol by Trump's mob, he was doing nothing to rescue tens of millions of Americans from the nightmare of COVID-19. Some employees were reportedly told to, quote, share PPE with other employees. Some were only given one protective face mask to wear for an entire week and were instructed to use makeshift isolation gowns out of plastic or paper bags that were, quote, stapled and taped together. Ms. Ramos, is someone who worked in a nursing home during those early months of the pandemic, how did these systemic PPE shortages affect you and the lives and work of your colleagues?
Thank you for your question, Senator. So during that time, we didn't have enough PPE, like I said. We were struggling to get PPE, we didn't have, they told us to use the same mask over and over again, and they told us to reuse the gowns. So we also had, when our staff members were getting sick, so we didn't have enough staff to work either. So we were short-staffed at that time also. And during that time, we called our organizer and let them know what was going on in our facilities. And our organizer had to come for a rescue and bring us the PPE and also tell them that they need to do something about the staffing, or the management has to come in and help out because we didn't have enough staffing. Like on Mother's Day, I remember clear that day, we had 26 residents that were very sick. And one of my residents, she asked me if I could stay by her bedside and hold her hand because her children were outside the window visiting her. And it broke my heart because we didn't have enough staff on. So there was only 2 CNAs working that day and a nurse working that day. So for 26 residents. And so it broke my heart because I told her I couldn't sit with her because I have other 25 residents that I had to care for. But we called the management, and the answer was we had enough staff on. So, and the PPE, our organizer had to drop off some PPE. But also the short staffing, it didn't start with the pandemic. It also started before the pandemic. We had a big shortage of staff. So the pandemic made things worse for us in the nursing homes.
Well, thank you very much for your service and also for your testimony. The previous administration's refusal or complete inability to do their job allowed one of the worst pandemics in history to run practically unchecked here in the United States. Dr. Grabowski, how did the Trump administration's failure to provide nursing homes with PPP and other essential health supplies affect their ability to care for residents in the first months of the pandemic?
Yeah, thanks for that question. As Chairman Clyburn mentioned during my introduction, I served on the Trump administration's CMS Coronavirus Commission back in 2020. And we were asked to take stock of what had happened up until that point and offer a series of recommendations to really provide nursing homes with a roadmap out of the kind of crisis that they were in at the time. And our recommendations included personal protective equipment, testing, support for staff like Ms. Ramos, better ventilation, and on and on and on, better data. All these issues have come up. Mr. Arbini talked about PPE and more transparency of data. You know, we had a really strong list of recommendations. Those recommendations were not incorporated. The administration said thank you, didn't put them into practice, and I think that cost us a lot of lives at the time. Congressman, if we had went ahead and really provided PPE to facilities, rapid testing, support for our staff, and on and on and on down the list, I think that death total I cited earlier would be a lot lower today. Thanks.
Thank you for your testimony. I yield back, Mr. Chairman.
Thank you, gentleman, for yielding back.